Hello and welcome to the short webinar on California Medicaid speech therapy coverage. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the California Medicaid fee-for-service coverage of speech therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check with payer policies. On the website, we have more detailed information on outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, information on MCO plans, coverage and prior authorizations, and members can always request information or ask questions about Medicaid coverage and compliance. A speech therapist must be licensed by the Speech Pathology and Audiology Examining Committee of the State Board of Medical Quality Assurance or similarly licensed by a comparable agency in the state in which she or he practices. Licensed speech pathologists may be reimbursed for covered Medi-Cal services performed by unlicensed speech pathologists working under their direct supervision to fulfill the required professional experience for licensure. The requirements for the policy are that the RPE trainee must have completed the required academic training and be acquiring the RPE as necessary for licensure. Speech pathologists wishing to use an RPE trainee to treat Medi-Cal recipients must be approved by the Provider Services section of the Department of Healthcare Services. The supervising provider must apply to DHCS to obtain an RPE trainee rendering provider number for the trainee. This number will have an automatic expiration date. Interested providers must contact DHCS RPE Services at 916-323-1945 for approval to bill RPE services. The supervising provider must bill for services and enter the RPE trainee's provider number in the additional claim information field, box 24K of the claim. Providers billing for services performed by an RPE trainee must add a modifier YW to HCPS codes X4300 through X4320 for speech therapy. Medi-Cal covers speech therapy services only when ordered on the written referral of a physician or dentist. The following information must be included on the written referral: the signature of the referring practitioner, the name, address, and telephone number of the referring practitioner, the date of the referral, medical condition necessitating the services, supplemental summary of the medical condition or functional limitations must be attached or included in the referral, specific services, for example, evaluation, treatments, and modalities requested, frequency of services, duration and medical necessity of services, specific dates and length of treatment should be identified if possible, duration of therapy should be set by the referring practitioner, however referrals are limited to 6 months, anticipated medical outcome as a result of therapy, therapeutic goals, data progress review when applicable. Evaluation. Speech therapy services rendered in an outpatient setting are limited to a maximum of 2 services per month, subject to the availability of Medi-service reservations. Initial and 6-month evaluations do not require a Medi-service reservation. Initial and 6-month evaluations billed with code X4308 require only that the recipient be eligible for Medi-Cal the month during which the service is performed in a certified rehabilitation center, NFA or NFB, or pediatric subacute care facility on the written order of the attending physician. A Medi-service reservation is necessary for each outpatient speech therapy visit provided by an independent practitioner. Visits to a Medi-Cal recipient in a nursing facility do not require a Medi-service reservation. However, treatment authorization request is required. Additional speech therapy services for full scope Medi-Cal recipients under 21 years of age are available through EPSDT supplemental services and require a Medicare reservation where medically necessary. Speech therapy services related to speech generating devices are reimbursable. The speech therapy codes X4310 and X4312 are reimbursable for all recipients. Treatment authorization requests for speech therapy for Medi-Cal recipients must be submitted to the TAR processing center. Speech therapy services rendered in an outpatient setting are limited to maximum 2 services per month, subject to the availability of Medi-service reservations. Initial and 6-month evaluations, X4300 and X4301, do not require a Medi-service reservation. Authorization procedures for speech therapy services rendered in a certified rehabilitation center or nursing facility level A or level B are the Medi-service reservation limitation of 2 services per month do not apply. Initial and 6-month evaluations do not require prior authorization, and a TAR is required for any additional speech therapy services beyond the evaluations. Thank you for watching, and please visit the website at therapycomply.com for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe, and we'll be adding many more videos soon.